Today we are going to talk about the diagnosis of epilepsy. So the diagnosis of epilepsy is there are multiple approaches which can help us to how diagnose the epilepsy. The first one is the history of the patient, in which we can ask multiple questions from the patient as well as from the family or attendant. We can ask the question that in history we can ask the question that how many times you suffered from the fits, or after how many days the complaint become revised. And we can also ask family history from the patient or the attendants, that anyone in your family that is suffered from the illness like this. So it will also support us. And past medical history can also support us, that we can ask that if the patient suffered from any other type of disease or illness before this. So this can also guide us to make a proper diagnosis. And we can also ask about drug history, because certain types of drugs can also cause seizure attacks, like opioids, amphetamine, cocaine, tramadol, etc. So these type of drugs can also cause seizure attack in a subject. So we can also ask about drug history. So the history can give us a much proper guide to make a good diagnosis. So we can ask these type of histories, and can also ask from the attendants that how the patient feel like when it become a seizure attack, that how it feel like, that how moments are, is the patient conscious or unconscious when it become attack with that complaint, or is the patient move their arm rapidly, continuously, or is the patient become the total body of the patient become rigid when the fits come to it. So these types, we can ask multiple types of questions from the attendants about the fits attack or seizure attack when it comes to the patient, that how it feel like when the attack comes over it. So these questions can lead us to a proper and a good diagnosis. So these are helpful for the diagnosis of the epilepsy. And imaging, we can also do proper imaging like CT scan or MRI scan. We can do it to see about other roots of this problem. For example, any tumor in the brain can also cause fits or seizure attacks, and So we have to find out the root cause. So these scans are the best option to find out other causes, like for example brain tumor, which can cause seizure attacks. So these scans are very helpful for the diagnosis. The standard diagnostic procedure for the epilepsy is the EEG, which is electroencephalography. In this technique or in this procedure, we observe different types of waves in the brain. So any problem with that can cause epilepsy. So it is a good study for the brain neurotransmission, through which we can diagnose epilepsy, and a standard procedure for the diagnosis of epilepsy, electroencephalography. Other types of tests we can perform, like CBC, which also can be helpful, or biochemistry, in which we can check the different ions concentration like sodium, calcium, etc., and can also perform a thyroid functional test. So these tests can also be performed for the proper diagnosis of epilepsy. So these things are helpful in diagnosis of epilepsy, and can lead us to a good and perfect diagnosis of epilepsy. So this is enough for today's lecture, that how can we diagnose epilepsy. In next lecture we will talk about the medications of different types of epilepsy, that what medicines are the best option, and what are the first line, what should be the second line. So in next lecture we will talk about that medication. Thanks.